Hello everyone, my name is Stacey Smith and I am here to talk to you about vitamin K2 from Gnosis by Lasoff. It is the essential healthy aging nutrient. So first I want to give you a little introduction to the K2 market. And as you can see from the graph, K2 has been growing at about 30% per year since about 2015. This is mainly driven by consumer awareness due to the fact that there's a lot of clinical validation, and a lot of that is driven by Gnosis by Lasoff, our company, and in the MenaQ7 space. So one of the ways that we determine that, obviously, is by looking at some surveys. And this survey is 3,500 dietary supplement consumers that 62% report using vitamin K2, and it was discovered as one of the top 10 ingredients used. It's interesting to see that the younger demographic is actually looking at vitamin K2 to be utilized for their health, and that's very important, but as you'll see later, it's kind of interesting that peak bone mass actually occurs at 18 and 20 years old for girls and boys. So we're asking them to make these decisions a little bit earlier, much like we asked them to choose their major for undergrad at that age. It's kind of entertaining. So this K2 space, nearly 60% of the people in the survey were looking for branded ingredients. And that's based on the clinical validation, which we provide, the quality of the ingredient, of course, and then the efficacy. Because we want people to understand and know that when you are looking for an ingredient, you want it to actually work. You don't want the excipients. You want to make sure what's in your product is actually what they say is in the product, and we provide that for you at Gnosis. So a couple key areas. The top two key areas from that survey K2 were used for was bone and heart health, which is the obvious reasons why people use K2. We have actually also looked into the kids space, and we're showing an 8 to 10-fold higher amount of osteocalcin use in that age, because that's when we're growing. That's when our bodies are building bone, and so it's obvious that we would need more of that K2 to support and activate the osteocalcin as we're in that age time frame. So this is one of my favorite slides, and I like to talk to patients about it. We look at vitamin K2 as protein activation, and these very important proteins that K2 activate, they're K2-dependent proteins that we activate, are called osteocalcin and the matrix GLA protein or GLA protein. So I actually like to talk about the matrix GLA protein first, and what it does is it defers calcium from actually, from building up in the arterial walls. So it decreases that calcification in the vasculature. And that's very important for us as we age. We're looking at that cardiovascular health and making sure that we have a decrease of arterial stiffness and lack of plaquing. So that's something that we're really looking for to provide that K2 to inhibit that process. The second thing is the osteocalcin activation. And the calcium actually promotes bone mineral deposition of that calcium. So without K2, we don't have the ability to mineralize our bones as much. It promotes that bone growth. So like all good things, we tell you all the great things about our vitamin K, but we're also going to tell you why we're potentially deficient in it. So vitamin K1 is typically used in the liver for blood coagulation, and vitamin K2 is used extrahepatically. It has a longer half-life. It's part of the menaquinones versus the phyloquinones. And so the K2 that we use is typically in the form of menaquinone 7. So the half-life, again, is greater, and it activates those proteins for us in the blood and for the bone. We can actually find enough K1 in our diet on a regular basis from green leafy vegetables. I'll bet you need to eat several cups of them. It's about 200 grams of green leafy vegetables, and quite honestly, not everyone has that, that diet. We tend to have a little bit more of that standard American diet here in the US. As far as K2, it's a little more difficult to utilize the K from our food. One of the main sources is called natto, and it's a fermented soybean, has this kind of sticky appearance from the fermentation. And that vitamin K2, obviously, most people aren't going to be consuming natto. It's very common, more so in a region in Japan. In the US, we may not have the palatability of that. So some people have talked to me about the, aged cheese is kind of like maybe a little odorific, for some people a little strong. Natto is very similar. I've actually had somebody tell me that it's compared to something like eating dirty gym socks. Smells the same way, so probably not something that we're going to consume here in the US too often. We like things that taste good. So that brings us to the fact that we have a vitamin K deficiency, and it's actually been shown in some surveys that up to 97% of people in the Western population have a K2 deficiency, and we're really not getting it from our food, obviously. So that's something that we are recommending having to do some supplementation with, because the only other way, I was listening to Dr. Scherger speak a couple weeks ago in Dallas at the A4M, and he was saying, the only other way for you to consume K2 would be to eat your own feces. And he showed a picture of a monkey up there, so it was kind of entertaining. So MenaQ7 is vitamin K2, has over 20 human clinical studies that validate it. We use our own MenaQ7 raw material, and as you can see, there's several different areas that we've done research with healthy populations, of course, bone and joint health. Then we've actually done some discoveries in kidney health, as well as then, of course, looking at the optimal bioavailability. And all of these studies are available for you on the MenaQ7 website. And of course, you can come to our booth and talk to us about it too, and we'll be happy to provide those for you. Okay, so we're gonna go through a couple of the main MenaQ7 bone health studies for you. So we talked about peak bone mass occurring about 90% for girls at 18 and boys at 20. Our peak bone mass for adults occurs at about 30 years old. And the point of that is that we all need that osteocalcin activation, especially in children at that young age, to provide that bone deposition of calcium. So what we're showing here is that the vitamin K requirement is definitely higher for kids. And also, we'll show you later, it's higher for elderly population as well for that bone and joint support. This is showing that low vitamin K status actually shows higher risk of bone fractures. So in doing studies with children, you really have to make sure that whatever you're giving them, especially in a clinical study, is going to be very safe. So obviously, vitamin K2 is a very safe nutrient, or else we wouldn't have been able to do these studies. So we did, to evaluate the bone benefits of vitamin K2, as MenaQ7, or MenaQ7, a randomized placebo-controlled double-blind study. And this study was done on 60 children between the ages of 6 and 10 years old. And we used 45 micrograms per day of the MenaQ7. And what it showed was the ratio of inactive to active osteocalcin reduced after 8 weeks of use, just 45 micrograms per day for these kids. So we're just taking a look and making sure, osteocalcin is that protein that we need to activate by way of vitamin K2. Now, of course, we did it in children. We also did some clinical validation in adults. So we actually found that 180 micrograms was the dose for adults that was the most appropriate per day to statistically significantly slow the progression of bone, bone loss, basically. So we're looking at, going from osteopenia to osteoporosis, and we're trying to decrease that progression. And we're looking at bone strength, and we're looking at compression strength of the bone as well. This was actually the first long-term intervention with MK7 for supplements for bone health as a 3-year study. So these graphs, if you take a look at the blue squares, that's showing you the increase of strength and compression of the bone, and against the placebo, which is the green dots, as you see. And after 3 months of taking MenaQ7, we actually show significant improvement of the activation of the osteocalcin. So just 3 months will show you that, but again, this study was done for up to 3 years. And as you take it longer, you actually get a better outcome. So that was our bone support. I'm also going to talk to you about the cardiovascular support. So vascular calcification, as we know in the US, cardiovascular disease is the most common cause of death in the Western world. So this is something, obviously, that we want to do something about and make sure that we can take care of and manage. Excess calcium can build into the vascular walls, causing arterial stiffness, then that arterial calcification, and then, of course, atherosclerosis. So as that happens, your arteries stiffen. It puts a greater workload on your heart. And so that, in and of itself, is not great. Blood pressure rises, all sorts of things happen, and people get stressed out and maybe a little angry, like they have blood sugar issues. Not related, but you get the idea of the symptoms. So along that, the plaquing can cause constriction, and that constriction can decrease the ability of our body to get blood, oxygen, and nutrients to the tissues. So obviously, we're looking at this as a problem, as well as the fact that it can lead to myocardial infarction. So the heart studies that we did with MenaQ7, one of them was a 3-year study that showed that supplementing with vitamin K2 decreased that arterial stiffness significantly. And as you see on the right, it actually increased the arterial flexibility, whereas the placebo group decreased, the flexibility wasn't there, and they started having more stiffness, actually. And this was done, again, at that study dose at 180 micrograms per day. So one way that we measure the stiffness of arteries is through this carotid femoral pulse wave velocity. And what we did was we did a 1-year and a 3-year study, again, with MenaQ7 as MenaQ7 for your vitamin K supplementation. And it actually stopped the progression of that arterial stiffness per that test that we were doing. And as you can see, the placebo, the dotted lines are a little hard to see on the graph, but the placebo group actually continued into their arterial stiffness, which is something, again, that we need to really consider and take seriously. The 3-year group, as you can see in the green dots on the bottom of the graph, it actually reversed that stiffness. So please take note of that. Come talk to us about that at our booth, because we really want people to understand that this is something that could be, I don't want to say a solution, but this is something that people should really take into consideration as they're aging. Okay, so I've been practicing for 20 years with patients, and I've been telling them to take D3 and K2 together for that amount of time, basically. So let's go into a little bit about why. So you guys saw the picture earlier. This is a little more in depth, but basically we're putting D3 at the beginning of that stage where we're actually increasing the inactive osteocalcin and the matrix GLA protein by taking vitamin D. And vitamin D is something that's very prevalent in society these days. People are getting their vitamin D levels tested with a very simple blood test, right? Most people understand that it supports immunity, and we're deficient in it. So the responsible thing for us to do is, if we're going to be supplementing with D3, we actually also need to be taking K2 in order to activate those K2-dependent proteins. So this study here shows with Children's Health that low K status actually increases the risk of fractures. Okay, this study was done with children looking at their bone mineral density. They had thalassemia osteopathy, and what we showed is that taking K2 and D3 showed a benefit in their bone building and a decreased risk of fractures. So, of course, as we like to do things with adults and children to show that we are going to be supporting all ages with this supplementation, we were looking at the benefits of D3 and K2 together. Of course, we were giving D3 without K2. And again, we're not getting that activation of those proteins. So we wanted to prove that it was better to increase that bone support and healthy aging to decrease the soft tissue calcification by taking both the MenaQ7 as vitamin K2 and the D3 together. So, of course, we don't want to stop there. Anything that's heart healthy, we want to make sure that we look at as a synergy. So, obviously, omega-3s are something that people know are for cardiovascular support as well. And so we took a look at cardiovascular support and the synergy of vitamin K2 as MenaQ7 for healthy adults. And then we were looking at actually omega-3 being a cognitive support for children and growth of their nervous system as they're aging and developing and learning, as well as their bone development, because obviously those two go hand in hand. Okay, so other emerging areas. Just looking at my time here. Of course, we talk about immunity with D3 because that's part of that aspect as well. Interestingly, K2 has some aspects in the immunity space as well that we would like to, look into and innovate with as well. And we are finding some really interesting things. We're also finding the protection against oxidation, which kind of fits in that immune category as well. And I'd also like to focus a little bit on the brain support that we found as we're going through this with our clinical experts. So we're looking at the new role of K2 as an immunomodulatory agent, and we're finding that it actually has an anti-inflammatory effect, optimizing immune cells, and what's really interesting, it actually has a place to decrease that calcification in the lungs, which is also gonna help us with the frequency and severity of the respiratory infections as well, which is something that we're obviously very concerned about these days. And just as an FYI to everyone, there's actually been a link between deficiency in K2 and COPD. So that's definitely something that we want to take into consideration as well when we're looking at these lung conditions. Again, we know that that combination of vitamin K2 and D3 will be beneficial for immune support, as we've already discussed. And then we want to look at how K2 can it support the brain, right? So we talked about arterial stiffness leading to arterial calcification, and then, of course, to atherosclerosis. And so we know that all of those things actually increase the prevalence and risk of dementia and cognitive decline. And as you think about it, again, we're looking to get oxygen and nutrients to our tissues, but as the tissues calcify and get stiff and decrease that flow of oxygen and nutrients to the tissues, we're also decreasing the ability of our body to detox some of the byproducts of just natural biological function. So something that you want to take into consideration when you're looking at cognitive health, which is a big space right now. People are looking at, trying to prevent progression of cognitive decline 30 years before they actually have it. So this is a space that we want to continue looking into. So with that said, MenaQ7 from Gnosis by Lasov, we are here to support you with over 20 human clinical validating studies. We have the quality, we've tested the efficacy, we are here to support you. We also support with not just the science, but also our marketing. We have marketing literature, a plethora of, and we have a great marketing team that can support you with co-op activities and things that, working with your design team and your social media team to get this message out there. Because I feel like it's really important for people to understand not just bone and cardiovascular health and support, but also for some of the emerging research that we've been looking into with all the other, obviously D3, omega-3, and then looking at the different spaces. So thank you very much, and I'd like to end with come for the science and stay for the partnership. If you guys have any questions, feel free to visit us at our booth. We're at booth 4652, and thank you very much for joining me.